You are watching the DocTalk show.
Tuberculosis, as you have learned, is an airborne infection. And some of the ways you can tell if you may be suffering from TB is if you have had a persistent cough that doesn't seem to go away, if you are experiencing fevers, if you have lost weight, or if you tend to sweat a lot at night. And we have also learned that TB can cause significant problems, particularly resulting in death if it is not treated, which is what brings us to this discussion about tuberculosis. What's the most important question is it curable? So I will ask our guest speakers in studio. Who would I start with? Dr. Baluku.
Yes.
Is TB curable, this disease which seems to cause so many problems in the country?
Absolutely. Tuberculosis is curable if treated early and if somebody takes the medicines religiously. So the neat and smart answer is yes, TB is very curable.
So TB is curable?
Yes.
And the medicines are available?
Yeah, so the medicines are available in all government facilities. They are free of charge. And so it implies that you can access the medicine and take it and nobody will charge you and the government will spend on you for a cure. Okay. But it's important for somebody who has TB to take the medicines religiously for about 6 months, a minimum of 6 months. In some patients, they may need it for a longer period of time if they have more complicated TB. But if you do not take the medicine, it implies this TB might come back, or this TB will become resistant to the medicine at all, and you need more expensive and more toxic medicines to kill this TB germ. It also implies that if you take this TB treatment and you don't complete it, you continuously damage your lungs, and so with time, you form a lot of scars in the lungs. And so you will find TB patients who have a lot of scarred lungs. They have so many scars in the lungs that they can no longer breathe very well, even when we treat the TB when they come back the second time.
So, Dr. Phil, maybe you would help us understand these medicines. Would someone take like 5 tablets at the same time? When we talk about TB medicine, what is it like?
You take the medicine once a day, usually in the morning, and you take it every day for 6 months. And although treating TB involves several different drugs, they're often rolled into one pill, and so you might take 3 or 4 identical pills that have a combination of medicines within that pill. That's really important, and that's the benefit of going to a public health facility, that they'll have access to these special TB treatment pills that you'll take for the whole 6-month period. And these tablets are used all over the world. They've been around for almost 50 years. And in fact, some of the most important trials in TB that led to us using this set of tablets were done right here in Uganda back in the early 1970s. And the studies done here in Uganda and Kenya and Tanzania formed the basis for modern treatment for TB with this set of drugs.
Okay.
And they work very well, and patients in general have very few side effects.
How effective are these drugs? How many people become cured after taking these medicines?
Yeah, that's a really good question, Darius. So if your TB bug is sensitive to the medicines, and that's something you can prove by growing it in culture, but if the bug's sensitive and you take the drugs every day and you take them for 6 months, pretty close to 100%, certainly 95 to 100% of the time, you'll be cured of TB at 6 months.
Okay. So what would happen if someone does not complete the treatment?
Yeah.
Problems arise in that scenario?
Well, we know from studies that for every month shorter in treatment, you lose perhaps 10% of the chance of cure. So if you only take 4 months of treatment, even if you've taken it, each day, that might bring you down to an 80% cure chance. But of course, people don't take a solid amount of drugs and then stop suddenly. They tend to stop and start throughout the week, and so they may miss a few days and have a few more days and have a crisis, and so not get some more drugs or have a stock out. And so they have a kind of staccato, or they'll take some drugs and not others on some days, and by 6 months they may have missed perhaps 2 months worth over that. And that's a really dangerous situation, because if you miss a lot of the drugs, then the risk is that the TB bug becomes resistant to those medicines that you're taking, and then harder to treat the next time around.
The TB can therefore spread if you don't take the medicine. It can go to your brain and then give you meningitis. It can go to the bone It can go to the backbone and you get weakness in the legs and you get paralyzed, and that's very difficult to treat. Sometimes patients never get back to walk normally ever. So it's important to take this medicine and complete it.
So speaking more about resistance, what exactly is a resistant TB? What does that mean, Dr. Baluku?
The TB becomes stubborn. If you don't take the medicine to completion, the TB stops to respond to that medicine. So if you were to take it again, it doesn't work. The bug continues to grow and grow and grow because it has become resistant. And that usually occurs in people who have taken the TB treatment and do not finish it. Even people who have taken the TB treatment, have completed it, and the TB comes back. There's also a chance that these people probably, their TB has become stubborn and resistant to the normal treatment. In health workers who get TB, have a higher chance that their TB is resistant compared to other people who are not health workers. And so those three categories are very, very important. And for us in Uganda, it's important to emphasize that when you take medicines that are not necessarily needed, if you take antibiotics, you get flu and then you go to a pharmacy and ask for Amoxil or Septrin or ask for Cipro. The use of antibiotics when they are not needed also increases the chance of this TB becoming resistant, particularly people who use Cipro and the common drugs that are used for flus and coughs.
And that's mainly because some of these drugs are also used as a second line. Maybe I'll ask Dr. Phil to maybe explain to the audience, this TB that is resistant to the first line, how exactly is it treated? Are these medicines easily accessible, or it is now the patient has to buy, what's it like treating this TB resistant strain?
Yeah, that's a good question. Let's try and give you some estimate at how likely that is, first of all. So we can only estimate here in Uganda, but we've got a handle on that, and perhaps 1 or 2% of all patients who catch TB for the first time already have resistant TB, because circulating in the community is a low level of resistant TB that we're breathing in. But if you're part of that group of patients who've had TB treatment, and then the TB comes back because the treatment's not worked, perhaps you haven't taken all the drugs, here in Uganda around 12% of those patients will have resistant TB, so 1 in 10.
Okay.
And it's important to recognize that increased risk of resistance in the people who require a second course of treatment. So you can first of all test for the resistance by going to a specialist centre, and then secondly that you can see a physician who is knowledgeable about drug-resistant TB, like my colleague Dr. Joseph. And Uganda is really very lucky indeed in having a national TB ward devoted to patients with drug-resistant TB that in the time I've spent here functions at a very high level of sophistication, and I'm very impressed with how they manage patients with drug-resistant TB.
So what happens to the other people who don't get cured?
So what happens is that either they will leave and disappear in the community, but the majority of them unfortunately will pass away because the TB has not responded to these drugs. These drugs that we use for drug-resistant TB are not as effective as the ones we use for the normal TB, and that's why
the drugs for the resistant TB,
yes,
they don't work
as the ones we use for the normal TB.
So the important message should be whoever has TB and it is responding to the first line, they should take these medicines and ensure they take it properly and they complete all the treatment so that they don't get the resistant bug. Okay, so as we conclude in the discussion about TB, what's most important, also what the community want to know, how it can be prevented. Dr. Phil, we've learned TB is an airborne disease, can breathe it in and get the infection. Are there ways someone can prevent themselves from getting this disease?
Well, I think it's a community or a societal act which is to try and detect TB early. So I think by all of us being aware of what those symptoms are of fever, prolonged cough, night sweats and weight loss and coughing up blood, and if you have that for more than several weeks, seeing a health centre or hospital where there's some expertise in diagnosing TB early so that you can get better, but also we can stop the spread in the community. So that will protect the community in general.
So
if you're a patient with TB...
if they have TB and they start treatment early...
Start treatment early.
Prevent other people from getting the TB, because the sick person is treated.
Exactly. Okay. But also, as my colleague Dr. Joseph said, TB is spread in close proximity, and particularly when you're sharing the same roof. And so, ideally, if you're a patient with TB who goes home, then the community workers will screen your family, and particularly the children, will put them on preventive treatment for TB and look after those children.
Okay. So it is mainly to do with addressing the risk factors like poor ventilation and overcrowding in the area. If someone is sick, they should be isolated in their own place. Is it?
It is that. And
for a period of time?
For a period of time, a few weeks certainly.
Okay.
And there's a third thing I wanted to bring up, and to come back towards the end of the program to talk about the importance of HIV. And people who have HIV are perhaps 20 times more at risk of developing active TB than patients who are HIV negative. And so these people are really vulnerable. Programs need to look out for TB in patients with HIV. And if you are around patients who have HIV and you yourself have TB, the likelihood of them catching it and developing TB is much greater. So that's a vulnerable group we need to think about.
So it's a group which people like Dr. Baluko need to focus on, the risk groups of people who are likely to get TB. So again, you're watching the DocTalk show. We're coming to the end of the program. We have had an in-depth discussion of tuberculosis, how it is transmitted, and what's most important is TB is a very treatable disease, and it is very preventable. It's treatable because the treatments are available in all the health centers in Uganda. They are free of charge, and you take them for about 6 months and you will become completely cured of the disease. Trouble arises if you do not take these medicines properly. You are at risk of getting what they call resistant TB, which is more difficult to treat. The treatments take longer and a bit more expensive. So I want to thank our guest doctors for joining us in the DocTalk show. And you can always send in your questions, feedback or comments on the social media platforms, and we will respond to each and every one of those queries that you post. So stay tuned next time.
You are watching the DocTalk show.
Dr. Kasenene, groundnuts have a certain amount of fat. Is it true that all fatty foods will make me gain weight?
So many people believe that foods that are high in fat will automatically make you gain weight. But that is not true. We know that healthy fats in certain foods will actually support weight loss. Foods like groundnuts, like almonds, like cashews, avocado, and chia seeds, and olive oil in moderation will actually help you to lose weight because they help you to stay satisfied. Get 1 to 2 handfuls of groundnuts or nuts per day, 1 tablespoon of chia seeds, and a couple of drops of olive oil will help you to lose weight. However, there are some fats like cooking oil that is refined and margarine that are known to increase your risk for weight gain. So we do know that some fats will make you gain weight, while most fats in moderation will actually help you to lose weight. There isn't any reason to be afraid of these as long as you take them in moderation.
So some fats are good, fats in seeds such as groundnuts, cashew nuts, or chia seeds, or olive oil and avocado are actually good for your health and help you to lose weight.